Hello, dear friends. We often talk about physical health, diet, exercise, sleep, but there's one important part of our well-being that tends to be overlooked, especially as we age: our sexual health. Today, I invite you to join me in an open, respectful, and heartfelt conversation about a topic many consider sensitive: masturbation in later life. Many believe that once we reach our 60s, 70s, or even 80s, our sexual needs disappear. That's simply not true. The desire for connection, affection, intimacy, these don't vanish just because we have a few more gray hairs. They might change in form, but they remain a part of us. Masturbation, from a medical and psychological point of view, is completely natural. It's not shameful. It can relieve stress, improve sleep, enhance blood circulation, and perhaps most importantly, it helps you stay in touch with your own body. There's nothing wrong with taking care of yourself. Your body, at any age, deserves attention, respect, and love. In this video, I've broken the topic into easy-to-follow sections: what masturbation is and why it's normal, surprising health benefits when practiced responsibly, important things to keep in mind for safety and comfort. When it's time to talk to your doctor, you can either watch the whole video or skip directly to the parts that interest you. All timestamps are listed in the video description below. If you believe this topic is important and valid, but still feel uncomfortable talking about it, leave a comment with the number 1. I'll personally respond and help you overcome the discomfort step by step. This is a safe, judgment-free space, and you're not alone. Section 1. What is masturbation and why is it normal? Masturbation, or self-stimulation, is the act of touching or arousing your own body to experience sexual pleasure. It's a completely personal activity that does not involve a partner. And the most important message I want to share here is this: masturbation is entirely normal, even in later life. For a long time, masturbation was seen as inappropriate or surrounded by myths and misconceptions. But modern science has clearly shown that masturbation is a natural part of human sexual experience. It doesn't harm your health when practiced responsibly, mindfully, and without becoming obsessive. For older adults, masturbation can actually offer even more benefits. As we age, our levels of sex hormones like testosterone and estrogen may decrease, which can affect libido or change how we experience arousal. But the need for connection, for warmth, closeness, and feeling good in our own skin doesn't go away. Masturbation can be a gentle, private way to maintain that connection. Additionally, many older adults may no longer have a partner or may face physical limitations that make partnered sex more difficult. In such cases, masturbation can help ease loneliness, promote relaxation, and support a more positive mood. The key takeaway is this: there is no age limit to personal pleasure. The human body continues to respond to touch, to intimacy, to care, regardless of age. If you've never thought much about masturbation or have always felt shy about it, I hope this section helps you view it in a more open, gentle, and scientific light. There is nothing wrong with caring for yourself, even through physical intimacy. Section 2. Health benefits of healthy masturbation. We all know that regular exercise, a healthy diet, and a positive mindset help us stay well as we age. But there's another factor, less talked about but equally important, and that is maintaining a healthy sexual life, whether with a partner or through masturbation. When done mindfully and in moderation, masturbation offers many physical and psychological benefits, especially for older adults. Here are some well-documented positive effects. 1. Stress and anxiety relief. Masturbation triggers the release of feel-good hormones like endorphins, oxytocin, and dopamine. These chemicals naturally calm the nervous system, lower anxiety, and enhance relaxation. For older adults who may be dealing with loneliness, grief, or medical stress, this can be a gentle and healthy emotional outlet. 2. Better sleep quality. Many older individuals struggle with insomnia or shallow sleep. After orgasm, the body enters a deeply relaxed state, promoting restful sleep. Instead of relying solely on sleep medications, self-care through masturbation can be a more natural alternative. 3. Improved blood circulation and heart health. Masturbation involves light physical activity, which stimulates blood flow and gently increases heart rate, similar to mild exercise. This can help nourish the cardiovascular system, which is essential for older adults at risk of high blood pressure or heart conditions. 4. Natural pain relief. Endorphins released during masturbation also act as natural painkillers. For seniors dealing with chronic pain, like joint pain or backaches, some may find relief or improved comfort after climax. 5. Boosted self-esteem and body connection. With aging, some people may feel disconnected from their bodies or less attractive. Taking time for physical self-care, including masturbation, can help rebuild a positive body image and remind individuals that they are still vibrant, lovable, and worthy of pleasure. 6. Pelvic health support, especially for women. For older women, gentle stimulation of the vaginal area can help maintain elasticity, natural lubrication, and blood flow, reducing discomfort and keeping pelvic tissues healthier. Section 3. How to masturbate safely and comfortably. English. Masturbation is natural, but like any health-related habit, practicing it safely and mindfully can help you gain the most benefit while avoiding unnecessary risks. Here are key tips that older adults should keep in mind. 1. Keep it clean. Before and after hygiene is essential. Make sure to wash your hands before and after masturbating. If you use any toys or tools, clean them thoroughly with warm water and mild soap, or with a toy-safe cleanser. This is especially important for women who are more prone to vaginal infections or urinary tract issues as they age. 2. Use the right lubricant. As we age, our bodies produce less natural lubrication, especially after menopause. This can make stimulation uncomfortable without support. Choose a water-based lubricant, preferably unscented and made for sensitive areas. Avoid household products like lotions or oils not designed for intimate use. They can cause irritation or infections. 3. Listen to your body. Don't push yourself. The body reacts differently with age. If you feel pain, fatigue, tightness in the chest, or discomfort, pause and check in with your body. Don't feel pressured to reach orgasm every time. Sometimes simple relaxation and self-connection are enough. For men who have difficulty maintaining erections, remember this is a natural part of aging, and there are many ways to experience pleasure beyond that. 4. Don't overdo it. Keep it balanced. While masturbation is healthy, overdoing it can leave you feeling tired or drained, interfere with daily routines, increase feelings of isolation if used to replace all social contact. The ideal is to maintain a healthy rhythm, not feel dependent on it, and stay connected with others emotionally and socially. 5. Create a private, calming space. Environment matters. Find a quiet place where you won't be interrupted. Soft lighting or relaxing music can help create a sense of comfort and safety. 6. Respect yourself. Most importantly, remember, masturbation does not make you immature or inappropriate. It is a form of self-care, emotional connection, and a beautiful way to feel alive in your body at any age. Section 4. When to talk to your doctor. Sexuality and masturbation are natural parts of life, even in later years. But like every aspect of health, there are times when the body sends signals that it's best to seek professional guidance. Reaching out to your doctor can bring peace of mind and may even help you detect early signs of more serious conditions. Here are some situations in which older adults should consider discussing their sexual health or masturbation habits with a medical professional. 1. Pain or discomfort during masturbation. If you experience burning or sharp pain in the genital area, muscle spasms or tension, deep pain in the pelvic or lower abdominal area, these could be signs of underlying health issues such as infections, vaginal dryness in women, or an enlarged prostate in men. These conditions are often treatable when caught early, so don't ignore them. 2. Unusual changes in the body. Be mindful of unexpected bleeding, vaginal or penile, painful or frequent urination after masturbation, numbness or loss of sensation in the genital area. These may indicate infections, nerve problems, or hormonal imbalances. Your doctor can run simple tests to find the cause and recommend treatment. 3. Persistent guilt, shame, or anxiety. Masturbation is normal, but if you frequently feel guilty or ashamed afterward, anxious about whether your behavior is normal, out of control, or unable to stop, interfering with daily life, you may benefit from talking to a mental health professional. A therapist can help you explore your emotions and rebuild a healthy relationship with your body and sexuality. 4. You're taking medications that might affect your sex drive. Many medications can influence libido, erections, or arousal, including blood pressure medications, antidepressants, diabetes drugs, cancer treatments. If you notice changes in your sexual responses, bring it up with your doctor. They may adjust your dosage, recommend alternatives, or suggest supportive therapies like pelvic floor exercises or safe lubricant products. 5. You simply want to live more fully, including sexually. You don't need to wait for something to go wrong. If you just want to better understand your body or explore how to maintain a healthy, enjoyable sex life, that alone is a valid reason to consult a professional. Today's healthcare providers are trained to support older adults with respect and sensitivity. They know that sexuality doesn't end with age, it evolves. How to start the conversation. Try saying, "I'd like to talk about sexual wellness at my age. I've noticed some changes when I care for myself. Should I be concerned? Is there a safe lubricant you'd recommend for someone my age?" A small question is all it takes to begin. And remember, There's no shame in taking care of your full self, physically, emotionally, and intimately. Conclusion: your body still deserves love. Dear viewer, we've just walked through a journey that's often difficult to talk about, but so important to explore. From understanding that masturbation is natural, to learning about its health benefits, how to do it safely, and when to seek medical guidance, each step is a meaningful way to help you live more fully, confidently, and kindly toward yourself. Actually, aging is not the end of intimacy, pleasure, or emotional connection. In fact, it's during this stage of life, after so many ups and downs, that you most deserve moments of peace, of self-understanding, of quiet joy. Whether you live alone, have lost a partner, or are simply curious about your body, you have the right to access clear, respectful information about your sexual health. If something in this video touched your heart, let it stay with you. You don't have to talk about it or share it unless you're ready. Just remember, you are not alone, and your body, at any age, can still be a source of joy, connection, and love. Thank you for spending your time here, for listening with an open mind, and for allowing this topic a space in your life. May you walk away from this video feeling lighter, freer, and more willing to care for yourself in the way you truly deserve.